Hello everyone. Today we're going to talk about atraumatic restorative treatment. We're going to talk about the definition of atraumatic restorative treatment. We're going to talk about its benefit, and then we're going to talk about the procedure, and then we're going to talk about biodentine. What's biodentine? Okay, let's start off with the definition of atraumatic restorative treatment. It is an alternative approach for managing dental decay, which involves the removal of decayed tissue using hand instruments alone. So we use hand instruments alone, usually without the use of anesthesia and electrical equipment. So we don't use here a high speed handpiece or low speed handpiece. Okay, so this is the definition of atraumatic restorative treatment. Okay, let's look here. So atraumatic restorative treatment can be preferred. So why do we prefer atraumatic restorative treatment? We use it to avoid the spread of virus particles. Uh, so atraumatic restorative treatment is based on minimal intervention dentistry approach that provides several benefits. So what are the benefits of atraumatic restorative treatment? They are, first of all, in order to avoid virus particles or avoid aerosol generation, save the tooth. This means that we fill the tooth instead of extracting it by filling it with certain restoration. uh, Third benefit is to reduce the chance of odontogenic infection. Finally, to manage pain. So these are the benefits, the four benefits of using atraumatic restorative treatment. Let's look at the procedure of atraumatic restorative treatment. First of all, we remove the caries using a hand instrument. Okay, as you can see the picture here, you can we can see here, we can use a spoon excavator or a hatchet to remove the soft caries. We remove firstly we remove the caries, and then we remove the soft dentine until we reach the hard dentine. Okay, until we reach the hard dentine. So first of all, so removal of the dental caries using hand instruments, and there is no mechanical drill. We don't use mechanical drill. And second, the thing we do, we restore the cavity with the filling material. We can use here, in this case here, we can see, as you can see, this is a deciduous teeth, and we're gonna fill it with glass ionomer. We're going to choose glass ionomer as a filling to restore the deciduous teeth. We're going to talk about the benefits of using glass ionomer later on in another video. And finally, so why did we use this atraumatic restorative treatment? In order to save the tooth rather than extract it. So why did we do all this? We removed all the caries, soft caries, and the soft dentine in order to save the tooth and avoid its extraction, to keep its place in the oral cavity. So here we maintain the vitality of pulp here. So what did we do? We maintained the vitality of the pulp by placing here over the hard dentine a base, and then we can put a final restoration in case of permanent dentition. In case of primary dentition, like here we have, for example, we have the smaller, this is a deciduous tooth, we put glass ionomer. We're gonna talk about it in details later on in another video. Let's talk about biodentine. Why choose biodentine with atraumatic restorative treatment procedure? For the following reasons. It's a biobulk fill. Biodentine is a biobulk fill. It does not make no staining. It doesn't make any staining to the tooth. It's good. It has good adhesion, short setting time. It's bioactive. Bidentine is bioactive. It limits bacteria propagation and its pH is equal to 12. It's biocompatible with the tooth structure and it has a compressive strength of about 300 MPa. Okay, so let's talk about what is bidentine. Bidentine is a new biocompatible bioactive material which